Hi everyone, today I'm going to talk about lumbar disc bulge, more specifically L4, L5, L5, S1. We've had many requests that ask how can we manage these symptoms at home. In the next 5 minutes, I'm going to show you a series of exercises that you can try to start them at home and that can help you to improve your pain and also your daily activity. But at the end of this video, I'm going to show you 3 important tips that you have to follow while you're doing these exercises. If you've never been in this channel, my name is Bob. I'm a physical therapist. I help people with simple tips and exercise to recover and get back to their routine. Make sure to subscribe to our channel for our weekly update. Let's get started. We're going to start this routine, guys, with Mackenzie exercise. This exercise can help to improve extension and promote extension in the lower back. Now, I'm going to show you the routine and you can give it a try. We're going to start with the gentle, using this pillow, and that kind of promote extension in your lower back. And you got to be patient, breathe in and out, and hold it in this position for 13 seconds up to 1 minute, guys, for a couple of rounds. You can progress this to using your elbow, staying there up to 30 seconds, breathe in and out, and go back and rest, and come back up. You can hold a little bit longer. If you felt that is good, feels comfortable, it doesn't aggravate your pain, you could probably progress it maybe a little bit higher and use the elbows and get more extension on the lower back. I would suggest for the first few weeks, try to stay pretty much gentle on that, which means start with the low and slowly build up to on your elbow and maybe on your arms after a few weeks. As you can see, the level that you can come up can go all the way up to here, but in this position I'm getting a full kind of like hyperextension on my lower back. Now, the most important part of this exercise is that it should relieve your symptoms and your pain, which means while you're doing this, after doing it, you will get better. It shouldn't spice your pain, which means if you felt it doesn't feel as good, maybe you push it a little bit too much high and modify that. Let's go to the next move. We're going to move to decompression exercise, which is a passive stretch that can help you relieve pain and your symptoms from your lower back. I'm going to show you how to do it. You can give it a try. You need 2 pillows, and in some cases maybe more, depends on the size of pillow that you have, to help you to do this stretch. You're gonna lie down on your belly. The pillow should be pretty much around your hip bone, and you're trying to basically relax your upper back, your lower back, and your hip, and try to breathe in and out while you're doing this stretch. This stretch passively can help you to, as you can see, my hip muscles are kind of like pulling down with the gravity, and my lower back pulling down with the gravity as well. And that creates some sort of decompression between your vertebrae. And that helps you to relax and relieve your pain. You're going to do this for 30 seconds to up to 1 minute. You can stay there. And breathe in and out. If you felt this doesn't feel the stretch, you can actually add on more pillow on top of that. You're going to do this exercise for a couple of rounds through the day and hold it for 30 seconds to 1 minute and practice it there for a couple of sets. Let's move to the next exercise. We're going to move on to nerve glide, guys, which is a great exercise that can help you to reduce your symptoms and your pain. I'm going to show you how to do it. You can give it a try. You can use this sit. If you cushion the sit, it can be more comfortable. You're going to do 2 movements, knee extension, and you're going to move the neck back. And then you do opposite, and the neck forward. And you're repeating this movement. As you can see, my toes is basically face to me in dorsiflexion. Bring it back up again. Down. Slow and controlled. You gotta repeat this movement for 3 sets of 10 to 12 and you got to do this sequence exactly as I'm doing. You can practice the same move on the other leg. It depends. If you feel more, you have pain in one side, try to practice in that side. Give it a try, guys, and you can definitely feel relief after doing this exercise. The last move that you're going to do in this routine is going to be back extension in a seated position. We're going to promote the extension to the back, and I'm going to show you how to do it. We're going to be in neutral seated position, and we try to put our hands around your lower back, and you're trying to move forward, and you're going to try to open up the chest to the point that you feel comfortable, and we're going to back to the neutral and back up again. As you can see, I'm applying slight pressure with my arms to promote that movement as well. Slow down, breathe in, and breathe out. I'm not trying to force the movement, I'm trying to gently push my hip bone forward and slowly back to the neutral. You can breathe in and out, and breathe out. Breathe in and breathe out. It's not a very quick move. I'm doing it gently around my own range, and I'm not going to too much hyperextension. Try to watch that as well. You can try this exercise for 3 sets of 10 to 15 repetitions, guys. It's very gentle, and it actually helps your back to move, and that movement is essential for your recovery. Let's go to the 3 tips that I promised you, and you can start this routine right away. The first thing that I would like to share with you guys is that rest is not going to fix your back. A lot of my patients stay in bed for all day and they think, okay, that's going to help them to actually recover quicker. But that's totally wrong. We would definitely recommend patients in acute phases to rest, but in a chronic phase, which means after a couple of weeks, you want to get back to your daily activity. Try to identify those things that does aggravate your pain and try to stay away from those, but try to stay active as much as you can. That's definitely going to help you to recover quicker. For many of you, after back pain, you may go and get your MRI scan and it shows some sort of changes in your spine. Now, what research and study has shown that your MRI cannot be the only tool for the diagnosis of your pain, which means in some cases people without actually any pain may go and get the MRI scan and they find similar kind of changes in their spine. And that could leave you with some sort of fear and a fear of avoidance of activity. And what I would suggest you to look at your MRI scan as one part of the puzzle and slowly try to see what type of activity can be done through the day. Work around those and you can slowly build up some sort of movement through your daily activity and improve your symptoms and recover quicker. The last tips that I would like to share with you guys is that for optimum results, make sure to follow this routine consistently, which means after a couple of days doing it and you feel better, don't stop this routine and say, all right, I'm not going to do it again. Carry on and use this routine as part of your daily activity, and this will help you to stay active and also minimize your recurrence of your back pain. I hope you guys find this routine helpful. If you have any questions, leave me a comment in my YouTube channel and I will get back to you quickly. Don't forget to subscribe to our channel, like and share this routine with your friends and family who need this. I'll see you guys in the following week with a new video. All the best.